Hello, I am Dr. Arman, third year resident in the chest medicine department. Today I am here to explain how to interpret a X-ray. Before that, we have to know what is a normal X-ray. Then only we can find the abnormalities in other X-rays. I have seen many doctors struggling with X-ray, but I'll explain in a very simpler manner how to interpret a chest X-ray. It will help also the final year students and the third year students who want to learn a bit about X-rays. First, what we see in X-ray when we get a X-ray, first we see the identification details of the person, the name, the age, and the sex, and the date of the X-ray in which it has been captured. These are important because identification is the foremost thing. We have to see whether we are checking the X-ray of the patient concerned only. The next thing is date. Date, we can compare the X-rays. Like if I have an X-ray now, for the same patient, if I have X-ray after 3 months, I can compare both the X-rays and I can come to a conclusion. The second thing that we have to see is that actually I will cover many points in how to see how to interpret a normal X-ray, and further also I'll make some videos regarding other diseases and their interpretations. So it will take quite amount of videos to explain the whole X-ray. So I'll divide this interpretation of X-ray series in around 10 to 15 videos. So let's start. First we have seen the identification, then we'll see the view. Yes, this is important because according to views of chest X-ray, our interpretations change. What are the views? If we say most commonly that we see is the PA view, posterior anterior view, AP view, anterior posterior view, the lateral view, then there is left oblique view, there is right oblique view, there is lateral decubitus view, and there is lordotic view. If you want to know what is lordotic view, it is that when the X-ray is taken with shrugging of shoulders just to displace the clavicle further upwards so that you can see the lesions hidden under the clavicle. The next thing that we have to see is the depth of inspiration. Depth of inspiration, how do we see? We have to count the anterior ribs. Now it is imperative to know how to count the anterior ribs and the posterior ribs. First we trace the rib from the back to the forward. If you can see, there are two ribs in the two rib shadows in the chest X-ray. The one that is more horizontal, like this one, this one, this one, this one. These are more horizontal. These are posterior ribs. These are posterior ribs. And what are the anterior ribs then? The more curved and vertical ones are the anterior rib. So this is the anterior rib. This is the first anterior rib. This is the second anterior rib. This is the third anterior rib. This is the fourth. This is the fifth. This is the sixth. This is the seventh. This is the eighth, and further downwards are the ribs. So now you can see what are the anterior and the posterior ribs. Okay, the ribs that are more horizontal are posterior ribs. Okay, the more vertical, those are anterior ribs. This is the first rib, second rib, third rib, fourth rib, fifth rib. These are all anterior ribs. And if you want to see the posterior ribs, this is the posterior ribs. These are all posterior ribs. Okay. Now, how to see the depth of inspiration? First, what we saw is identification. We saw identification. Second, what we are seeing is depth of inspiration. Sorry, my handwriting is not that good. Yeah. Second is depth of inspiration. Now, how will you see depth of inspiration? We have to count the anterior ribs. There should be at least 6 anterior ribs in the left side. It should not be less than 6. It has to be either 6 or more than that. Now, let's count on the left side. 1, 2, 3, 4, 5, 6, 7. So there are 7 anterior ribs on the left side. So this X-ray, in this X-ray, the depth of inspiration is adequate. Now, what is the problem? When do we call then shallow depth of inspiration? When there are less than 6. Suppose there are 5 5 anterior limbs on the left side, then it is a shallow inspiration X-ray. What are the problems? The problem is that when it will be a shallow inspiration film, the diaphragm dome will be higher up, and while inspiration, if we take an adequate inspiration, the diaphragm comes down and it pulls the heart downwards. Okay, now if the inspiration is shallow, this thing will not occur. What will be the result? There will be then the cardiac, the heart will be pushed above, and the transverse diameter of the heart will be more. So there might be an apparent cardiomegaly. There might be an apparent cardiomegaly. It is not an cardiomegaly. We'll talk about cardiomegaly in a separate video, how to see cardiomegaly in a chest X-ray. So in short, if the depth of inspiration is shallow, then the transverse diameter may increase on the of the cardiac shadow. So there might be an apparent cardiomegaly. Another thing that may happen is that when there is shallow inspiration, the diaphragm is moved up. What happens? The pulmonary vessels in these regions, they all become very congested, and there is more reticulations and shadows mainly in the lower zones. So it may mimic as a lung collapse or lower zone infections. So these are the pitfalls we have to check, and we have to see whether the depth of inspiration is correct or not. Okay, then after completing the depth of inspiration, what we go forward for further is rotation. Rotation of the X-ray is very important. Now, how do we see the rotation? You see these white structures. These are the spinous process of the vertebral bodies. Now you have to draw a straight line from this. Okay, this is pretty straight. Then what we have to do is we have to find the medial end of clavicle. This is the medial end of clavicle on the left side. This is the medial end of clavicle on the right side. Then what we have to see is the distance, the distance between the two. This distance and this distance should be equal. Okay, so if this distance is equal, the X-ray is not rotated. Okay, now suppose if the clavicle starts from here, suppose the clavicle starting from here, and this one is here and this one is here. Okay, now if we see the distance, this distance and distance is not equal. The distance B is more than A. Now in this case, what we see is, that means the right side is out. The right side is out. Okay, and also this is also important. Before you get an X-ray, always see whether the marking on the X-ray is right or wrong. Sometimes it happens the markings erroneously the radiographers mark this as the right side. So it is your duty to check whether this is actually the right side or this is the left side. Radiologically, what you can see is that in the left side, the bulk of the cardiac shadow is basically on the left side and not on the right side, and there will be of course a marking. The apex of the cardium of the heart will be on the left side. The more of the volume of the heart shadow will be on the left side. Only one third part of the heart shadow will be on the right side. And another thing that you can see is that usually the right dome of diaphragm is higher than the left dome of diaphragm, because there is lever present in the right side. So this is how you understand whether it is right or left. Okay, so in this case you can easily understand the right side is out. Okay, because the distance B is more than A, so the patient is rotated towards the left. That's why the right side is out. The patient is rotated towards the left. Okay, so why this rotation is important? Because we have to talk about the trachea position. So if the X-ray is rotated, we can't comment on the position of trachea. This area, more blackish area that you see, is the trachea. Okay, so this is why the rotation is important. Fourth point that we see is exposure. Now this one is a bit difficult, but I'll make it easy for you. The next thing, that is exposure. What do you see whether the film is adequately exposed or not? Now how will you get to know that? You have to see the lower vertical bodies, that those are present at the back of the cardiac shadow. You will be able to see these intervertebral discs, and these are just barely visible. Okay, now if that means if the intervertebral discs are just visible, the X-ray is adequately exposed. Now what happens? You will see sometimes in certain X-rays these intervertebral discs are very much easily visible, and the lung parenchyma here looks more black. Okay, that means that is overexposed X-ray. What is the problem with overexposed X-ray? Sometimes we may miss some nodules or opacities that are already present actually in the lung. Now there will be another X-rays when you will see these intervertebral discs are not visible at all, that these are white and opaque, and the lung parenchyma is also whitish, that is underexposed. So in this, what happens, it will the periphery the peripheral lung parenchyma will look more white. It will give false positive results. There might not be any nodules or reticulations or opacities, but it will look or feel like there are abnormalities, or there are increased bronchovascular markings. So this is an important point to remember: exposure. If the exposure is not correct, we may either miss the findings or we may get false positive findings. The next thing that we are going to learn is lung zones. This is very important, because in an X-ray you need to know where is the abnormality. Now how to see the lung zones? Now the lung zones. Now how we define the lung zones? We define the lung zones into three categories: the upper zone, the middle zone, and the lower zone. The upper zone, the middle zone, and the lower zone. Okay. Now here is the first rib and the second rib. Okay, this is the first rib and the second rib, and this is the lower border of the second rib. This is the lower border of the fourth rib. So from apex to lower border of second rib is the upper zone. To lower border of fourth rib is middle zone, and below the lower end of the fourth rib there is the lower zone. So any opacification, suppose there is a homogeneous opacity here, you will say the homogeneous opacity is present in the left upper zone. Suppose this is present here, the homogeneous opacity is present in the left middle zone. Suppose it is present like this, then you will say the homogeneous opacity is present extending from the second zone to the fourth zone. So this is how we define the zones.